Hello everyone, welcome again to our lunchtime Q&A on the vaccine, fertility and pregnancy session. This is the fifth session that we've run in this series and they've been really popular. So today we're hosting on Teams live. In the last session, unfortunately, we had to turn people away because we had so many attendees. So we're hoping that rectifies that. The session today will be recorded and we'll share the link after the session through our usual bulletins in the usual way that we do. My name is Alex Watson. I'm the engagement lead on the vaccine programme here in London, and I'm joined today by a really fantastic panel who I will introduce you to shortly. They're here to answer any questions you have. So although we're focusing on fertility and pregnancy, feel free to answer anything. Feel free to ask anything that you want today. And we'll also be circulating our FAQs after the session. I'm going to introduce you to our panel now. So we have 4 people on our panel today, and I'm just going to ask them to introduce themselves. And then at the end of that, Helene Brown, one of our medical directors, is just going to speak a little bit about the current situation on vaccinations in the UK. So Garima, did you want to introduce yourself first?
Hello everyone, I'm Garima and I am the consultant gynecologist and the fertility lead at the Homerton University Hospital. And if the people are re-attending this webinar, which we did last time, there's been lots of updates, so just worth listening it again. Thank you.
And Memuna, did you want to introduce yourself, please?
Hi, my name is Memuna. Can you hear me, Amy?
Yes.
Hello, my name is Memuna. Unfortunately, I'm having technical difficulties with the camera for me to be seen. I'm a specialist midwife in Croydon Health Services. My name is Memuna Sowe and I work for the homeless health team.
And Martin, I don't know if Martin has joined us yet. I can't see him. So Helene, did you want to introduce yourself and just say a few words for us?
Good morning, everybody. My name's Helene Brown. I'm a GP in Newham. I've been working in the NHS for about 30 years now. I actually started off life as a nurse and then trained and did medicine down in London, where I've been based since the mid-90s. As well as being a GP in Newham, I'm one of the medical directors working for NHS England in London, and I'm the clinical lead for the vaccination programme and the rollout across London. It's a real privilege to be here with you all. Thank you for having me.
I'm going to move on to the questions that we are seeing in the chat. Please feel free to keep posting them. And yeah, I'll start with the first one that I can see here. So is it safe to have the vaccine at 33 weeks of pregnancy? Or is it better to get this done after, as I don't have long?
Do you want me to answer it? Do you want?
Garima, did you want to answer that?
Yeah, of course I can. And I think I'd encourage you that if you are 33 weeks pregnant, it's absolutely safe. The recent data has come from US, from 90,000 women who have had the vaccine, no safety issues there at all. But I think what you should do is you should speak to your midwife or the healthcare professional about the risk-benefit analysis of the vaccine and the situation you are in at the moment and see how comfortable you feel. And at the end of the day, it is your choice, but I have got no concerns about the safety of the vaccine, more so because if you contract COVID at the later part of the pregnancy, the outcomes are slightly more difficult than when you have in the earlier part of the pregnancy. Thank you.
Helene, did you want to give that your overview now? Sorry, I think we've got a little bit lost in this because I genuinely can hear about 6 people speaking at once.
No problem at all. It's one of the challenges of live teams, I think, isn't it? So no problem. So yes, we've now vaccinated more than 27 million people in England now, which is just extraordinary. And over 9 million people have had their second dose. We've got 3 vaccines that are approved for use now in the UK. So you will have already heard of AstraZeneca and Pfizer-BioNTech. We've now got Moderna as well. All three of the vaccines have met really strict standards for safety, quality and effectiveness. They've been independently tested through the UK's regulators for vaccines, which is the Medicines and Healthcare Products Regulatory Agency, the MHRA to its friends. All of the approved vaccines have gone through really extensive clinical trials and safety checks like any other licensed medicine. And the MHRA follows all of the international standards for safety. We continue to vaccinate people in order of priority, as set out by the Joint Committee on Vaccinations and Immunisations, the JCVI, and so that is by age and by clinical risk. You may well have seen last week, as Garima was just describing, the JCVI have amended their information and advice for people who are pregnant. And so they have now said that pregnant women should be offered the vaccine at the same time as the rest of the population based on their age and on their clinical risk. And they've also advised that there's a preference to offer pregnant women either the Pfizer or the Moderna vaccine. And the reason for that is there's been some real world data in the US where about 90,000 pregnant women have been vaccinated with either Pfizer or Moderna, and there have been no safety concerns at all raised about those vaccines. And so that's the reason why the JCVI have said there's a preference now in the UK for us to offer pregnant women Pfizer or Moderna. And so hopefully today we'll be able to answer your questions or concerns about the vaccine, particularly about fertility and pregnancy. But we're happy to answer any questions that we can. And if we don't know the answer to a question, we will come back to you and find out the accurate information for you. And I think my other reflection, if I may be so bold, is just to share my personal experience of having lived with endometriosis, had difficulty getting pregnant, and then when pregnant with my first, what I called miracle baby, ended up having to have huge abdominal surgery in the middle of my pregnancy. And so I really feel like I've lived through anxieties about becoming pregnant and about being pregnant and the sleepless nights that have occurred as a result of that. And so I hope knowing that will help to free you to ask any question you like. There is no question that is stupid or foolish or naive, even if you're a medical professional. I had all of those myself. And so I just want to give you that freedom to ask anything, absolutely anything. There is no foolish question. That's me done.
Thanks, Helene. I think I might have sorted out my technical issues now. I can't hear 14 people in my ear, so that's a bonus. So apologies for that. OK, I'll move on to the questions that I can see now. So the next one that we've got is, I'm trying to get pregnant. Is it safe to have the vaccine? And what are the risks and benefits of vaccination whilst pregnant? So Helene, did you want to answer that? Or Memuna, if she's here?
I'm very happy to answer that. So if you're not pregnant currently, it's absolutely fine and safe to have any of the vaccines. If you're trying to conceive at the moment, there is no advice about any of them being better than the other. You will be invited according to the JCVI guidance, so according to your age or your clinical risk, and then you can have any of the three vaccines. I missed the second part of the question, Alex, because I had a bit of echo then. What was the second part?
And the second part was just to outline the risks and benefit of vaccination whilst pregnant.
Thank you. I don't know, Garima, if you want to take that one in terms of what the risks or benefits whilst actually pregnant.
Right. Yeah, I'll take that, Helen. Thank you so much. The risk is, the only risk I can think about the vaccine is that we do not have very extensive data about that. But having said that, from such a long time, we have been using the similar kind of vaccines like the flu vaccine, diphtheria, whooping cough vaccines, etc. So there's absolutely no reason that why this vaccine should be behaving any differently from all these vaccines. Now, the benefits are manifold. And I think one of the thing is that we have seen in pregnancy that if you have COVID, for the baby, you are much more prone to have a preterm labor if you have a critical disease. Although the major side effects, thankfully, with the COVID in the pregnant women are still very little, but the vaccine does prevent you from any sort of a serious illness. The other thing that I think that if I'm going to try to conceive is about the baby as well. And as you know, that immunity in the babies doesn't come automatically, right? And when you have the vaccine, your body produces the antibodies and that goes to the baby. So the baby has the protective effect. The last thing that you do by taking the vaccine is that you're protecting everybody else who could be in your area of working, either in your house or the workplace that is protected. So my advice would be, whatever stage you are in, whether you're trying to be pregnant or are pregnant, just go for it. Do you want to add something, Helene?
No, I was nodding in agreement.
Thanks, Garima. So the next question is, I'm 22 weeks pregnant and I wish to breastfeed after my baby is born. Is it safe?
Yeah, it's safe.
Does anyone want to add anything else to that? I think Memuna is having trouble speaking, unfortunately. Okay. The next question is, can I ask about the side effects of the Moderna vaccine? This hasn't been widely discussed as the side effects of other vaccines. Helene, did you want to take that one?
Yes, absolutely. And so the side effects of the Moderna vaccine are very similar to the side effects of the other two that we've experienced so far. So the most commonly experienced side effect is bruising in the area of the injection site that usually settles within 24 to 48 hours. And then a small number of people experience sort of sometimes people experience a sort of slightly raised temperature, slight chills, that sort of shivery sort of sensation. Some people get mild muscle aches and pains. All of those things usually subside within 24 to 48 hours, and they can be managed if necessary with paracetamol and rest if you need to. But there's no particular specific things that are unique to the Moderna vaccine compared to the other vaccines that we've been using.
Thanks, Helene. So we've got another pregnancy related one now. So I had the first vaccine before I was pregnant. I am now over 12 weeks pregnant. Is there any value in having the second vaccine, as it is over 12 weeks since the first vaccine, or do I need the full course again?
Garima, do you want this one?
Yeah, can answer that. I think there is a value of taking your second dose, and you have passed 12 weeks, and not that it is going to be harmful in 12 weeks, but I think usually there are anxieties because that is the first 12 weeks is the time where the baby's parts are being formed inside the womb. Now you've passed that point, and I think if you take the second dose now, and I reckon that you had the first dose because you are in one of those priority group, I think it will be still very beneficial to you that you're still not in third trimester where the risk of catching the disease and having severe illness is more. So I would suggest that if you are going for a second dose, go for it. Helene, would you agree?
Absolutely agree. Yes, definitely to have the second dose. Some people choose to wait till after the 12 weeks, but it's not essential to do that. I completely agree with you.
I would also agree with that, ensuring that you're having the same vaccine you had the first time for your second time round, so you won't have to change vaccinations. So continue with the first dose you had, repeat that for the second dose as well.
Thanks, Memuna, and really nice to hear you.
Yeah.
Okay, as healthcare professionals, are we actually now recommending vaccination to pregnant and breastfeeding women? There is a difference between a recommendation and leaving it to personal choice.
I can also take this. So yes, we are recommending the vaccine for pregnant women. However, everything we do offer is by choice. So women still have the right to make their informed decisions, the right to make their choices, and also to read about the vaccines. Make sure that you're giving informed consent, you're reading information that's reliable, and I would strongly recommend for anyone thinking about the vaccine whilst pregnant to look at the RCOG and Royal College of Midwives. They've done joint statements reassuring information around the vaccine and around fertility. So definitely make informed decisions
Thanks, Memuna. And we are going to put the links to that evidence in the chat, and we will circulate it afterwards. It's also part of our FAQs. Did anyone want to add anything to that? Garima, I think you were going to say something.
Yeah, absolutely. I absolutely agree with Memuna on that. One of the group that is specifically asked to be encouraged for the vaccination in pregnancy are people who have got the BMI more than 40, who are coming from certain ethnic group like Asians and Black people, and the diabetics, because what they have seen the correlation is that if you have COVID, the severity is more. So these people are being encouraged to take it. But again, this is down to the woman. It is not a coercive vaccination. It is just understanding the risk and benefits of the vaccines and then making an informed choice.
Thank you. So we've got an IVF question here. I've had both doses now of the vaccine, and I want to know how long before I can start my IVF cycle.
You can start it immediately. There's nothing to say that you should wait. The only thing that I would add here, that if you have got a side effects like fever, chills, muscle aches, etc., which last about 72 hours or sometimes slightly more, just wait for that period to settle down. But you do not have to wait any longer than any other person.
Okay, and there's just another, it's a little bit further down, but I'll just ask it now. Will the vaccine impact any medications during fertility treatment?
Absolutely no, nothing at all.
Okay, great. Okay, does AstraZeneca affect fertility at all?
Very interesting question. None of the vaccines, let me make it very clear, not only AstraZeneca, none of the vaccines affect any kind of fertility. There's no plausible mechanism to affect the eggs or the sperms in any way at all.
Thanks, Garima. I've got another one here. This is quite a long question, so I'll just try and read it out directly. My question is about the study that's been done in America on the 900,000 pregnant women who have had the COVID vaccine. Regarding the study, for women to carry to term and for us to know if there were any risks, these women would have had to have the vaccine in July when it wasn't widely available. This is my understanding anyway. Is this what happened, or have the studies been done on women who haven't given birth yet? Helene, did you want to take that one?
Yeah, you're absolutely right. So all the vaccine information, this is all iterating as we go. And so the 90,000 women have had their vaccines, they've been having their scans, and obviously we need to wait for the 9 months, but there is no evidence so far of any safety concerns at all. Everything in their pregnancies is progressing as we would expect it to do. I don't know, Garima, if you've got any other information.
I haven't, exactly the same, but I'll just try to reiterate that what everybody has to remember, that RNA vaccines have been, and the similar sort of vaccines have been used for a very, very long time. And again, I say there's absolutely no reason to believe that these vaccines, which are almost similar to flu vaccines, are going to be any different from the rest of the vaccines.
There's a couple of questions which are along similar lines, so I might just move further down a bit. So this might be one for you, Helene, because I think we've been discussing this. The advice is to get Pfizer or Moderna vaccine. How do we make sure that we get these ones when we're booking?
Yeah, it's a really good point, and it's a very live topic. I don't know if people are watching Twitter, but Stella Creasy tweeted about that issue yesterday. For those of you who don't know, Stella is an MP who's currently pregnant and based in North East London. She raised a really valid point. So with the programme, obviously this is new and things are changing and iterating all of the time. And some of the booking systems require changes to take place that we just can't get them to move as quickly as sometimes some of the information is that's being released. So in terms of the national booking system, they are looking at a way of being able to indicate on the sites as to which sites have got which vaccines. But we are in the process, and I was on a meeting about it just this morning with all of the systems, the integrated care systems across London, to look at the workarounds that they're having for how you can identify which sites have got which vaccines. Ultimately, at the moment, it's not brilliant. It's clunky. I will hand on heart say it's a clunky system. It's requiring people to have conversations. And what we've been advising people, and the discussions that happened today, was that for women to have a conversation with their midwife or their GP, with whomever they've made their first contact about their pregnancy, to help them identify the sites that are local to them that have got either Pfizer or Moderna. So you will be able to get it. There's no problem with being able to get the right vaccine. It might mean a couple of conversations in order to be able to do it, but we are working really hard to be able to smooth that system out. So I'm hopeful that, you know, sort of in a week or two's time, we'll be able to say, oh, you can work that out very easily by this process. But at the moment, it's not quite there. It's still clunky. So I'm sorry about that. But we are working really hard to get that smoothed out.
Thanks, Helene. Okay, I had my first vaccine at the end of January and I'm currently 6 weeks pregnant. I was due for my second vaccine last week. Is it possible to have the vaccine when I'm 12 weeks pregnant, which means I'll have a gap of 4 months instead of 3? Memuna, did you want to take that one?
Yeah, hello.
Did you hear the question? Hi, Memuna, did you hear the question?
No, I didn't. Apologies.
Oh, okay, I'll ask it again. I had my first vaccine at the end of January and I'm currently 6 weeks pregnant. I was due for my second vaccine last week. Is it possible to have the vaccine when I'm 12 weeks pregnant, which would mean a gap of 4 months instead of 3?
I would definitely agree for you to go ahead and still take your vaccine. And again, as I said at the last question, ensuring that you're taking the same vaccine you took the first time. It's always worth, if you're not sure, to always speak to your health professional. So again, liaising with your midwives, with the obstetricians within the units where you're booked to discuss your concerns, because most hospitals will have leads or champion in the area of COVID vaccination in order for you to seek that one-to-one individualized advice based on your situation rather than everybody else's.
Thank you. Sorry, I'm just scrolling through some, trying to find, because I think some of these we've already answered. I'm going to ask this one. I think we have already. Sorry, Helene.
Sorry, whilst you were scrolling, I was just going. I think Memuna's just made a really important point, and just wanted to emphasise it that all of the hospitals and all of the units do have people who are prepared and ready and equipped to be able to have those one-to-one conversations, because everybody's situation is different, and so don't be afraid to ask. You know, someone you trust either within your service, or if you wanted to speak to somebody outside of your service or have a conversation outside of your trust or organisation, let us know. There are ways that we can do that so you can get the confidential supportive advice that you need for your set of circumstances.
Okay, so someone's asking a question here. I think this is a general question about, is it better to wait until later in your pregnancy to have the vaccine rather than early? So they're saying, I'm 10 weeks pregnant, should I wait? Or should I have it now, I think? Garima, did you? Oh, sorry, Helene.
Go on, Garima, that's fine. I just wasn't sure who you were directing it to, Alex. Sorry.
See, it really depends on how comfortable you feel. There's nothing to suggest that the vaccine is going to be harmful to you. Even if you want to take it at 10 weeks, it's going to be absolutely fine. I think it's about our own anxieties, like when I was pregnant, I just wanted to make sure that the baby has reached about 12 to 14 weeks, even before I thought about a paracetamol, right? So I do understand how people feel that anxiety, and unless they have that 11, 12 week scan. So if you feel comfortable by doing that, by all means do that. It's not going to make a significant effect in terms of protection that you get from the vaccine. So see what is your comfort zone and act according to that.
Thanks, Garima. This is a question about the different types of vaccines, and I think this is probably for you, Helene. Why do we not get a choice of the vaccine to take? So I'm assuming that means regardless of whether you're pregnant or not, because obviously now if you're pregnant, we're recommending certain ones. But outside of that, why are we not giving people a choice?
And again, that's a really important question, because lots of people have different thoughts and beliefs about the different vaccines, which, you know, are personal and come from, you know, the things that they know about the drug companies or what's happening in their communities, either in this country or in countries abroad. And I think it's a really valid question. The main reason that initially at the beginning of the programme we've not been able to offer choice is just because of supply. And about the way that we've had to set up and stand up the service so very quickly to think about getting the vaccines, as much of it, to the people at the most risk right across the country, and in a way that's mean that we're trying to be as equitable and give as much access to the people who needed it most as quickly as we possibly could. And so initially we didn't have both vaccines straight away, and then when we did, there were different volumes of the vaccines, of the Pfizer and the Moderna, the Pfizer and the AstraZeneca initially, and now the Moderna's come online, but you know, the amount of that isn't as much as we've had of the others yet. As time goes on with this programme, that will all change as the volumes increase and as we get into more of a business as usual rhythm about what's happening with the vaccines. That will all get better, and there may well be more opportunity for change. What we're having to do at the moment is think about the characteristics of the vaccines and the latest advice that's being given to people about who should have which vaccine. So, for example, both the Pfizer and the Moderna vaccines are quite difficult to transport, and so for doing one-to-one home visits, it was really difficult to use Pfizer at the early part of this programme, which was all we had at that stage. It was really difficult to take that out because it was so unstable to transport. So the only option when it came online for home visits and for places like care homes and things where you needed to travel around quite a lot was to use the AstraZeneca, because that was stable when transported. And so, you know, some of the situation was dictated literally by where somebody was located and how easy it was to get them to a vaccine or to get the vaccine to them. And then also the issues that we had is that some sites were not able to store, for example, the Pfizer vaccine because of the storage requirements. They didn't have access to the super low temperature freezers, for example. All those sorts of practical things which come out of having new vaccines that haven't yet had the many iterations that a lot of other vaccines have had, have meant that we've sort of had to bend the programme and move it around the characteristics of the vaccines. And so that has restricted choice, there is no doubt. We're not yet in a place where we've got enough supply of all of the spread of vaccines to be able to say to people, these are all of your options. So with Pfizer and Moderna, we're now having to think, right, well, all of our pregnant women need to have access to Pfizer and Moderna. And so if somebody can have AZ and they don't need that Pfizer Moderna, then the preference is that they have the AZ. And so we're having to make those sorts of choices just because of the different characteristics and the iterating advice that we're getting from JCVI. I hope that makes sense.
Thanks, Helene. That was really, really clear. Thank you. How can we be sure that the vaccine doesn't affect fertility when it was only rolled out 4 months ago? Garima, do you want to answer that one?
You are absolutely right. That is a very interesting question. So the surety comes from the characteristic of the other vaccines that have been given to people from I think about 50-60 years now. Now, just to make it absolutely clear in terms of what has been done in the fertility field so far. So in terms of eggs, what they have done is a very short study, I think it was in Spain, that they checked the characteristics on the surface of the eggs from the egg donors who had the COVID that was asymptomatic. And they found there is nothing on the surface of the egg that expresses the COVID receptors at all. So although I do take this point that it's extremely a small short of a sample size, and as we go forwards, there's lots of studies are being conducted in the medium term and a long term sort of a fertility things, which data is not available, but I'm sure as we go forward in the year, there would be some data available. But looking at the experience from the similar kind of vaccine, there's nothing to suggest that this vaccine would be doing anything different in terms of fertility. Now, just to make it very clear, COVID and the vaccine of the COVID are two different things. So if the question is, does COVID affect fertility, there's a different answer. But COVID vaccine, certainly, I can say with some degree of confidence, is that there will be no effect on either a female or a male fertility based on the experience from the different vaccines. Helene, do you want to add something about that?
No, I think you've summarised it beautifully. Thank you.
Thanks, Garima. Hi, Memuna. We can see you now, so I'm just getting you to wave to everyone and say hello. OK, there are a lot of questions and we're unlikely to get through them all. So what I'm going to do is try and answer some of the get people to answer some of the ones that we haven't covered yet. So I think this is a really good question. Can you tell me more about the outcomes that you mentioned for those people who don't get vaccinated and then contract COVID during pregnancy? Memuna, since we can now see you, did you want to try and answer that one?
Just need to unmute.
I think you're still on mute, Memuna. Oh, better, thank you.
Again, the population that we do immunise, I'm quite fortunate to work with a diverse group in Croydon that immunisation is offered actually to the less privileged or people that don't usually have access to a vaccination programme. And I think that's a really good question, why should you have this vaccine at this stage? We're offering it to protect you. Again, I'm going to make sure that it's so clear on this platform that when we're offering this vaccine, it's no way forcing anyone to have it, to educate and to ensure safety. So I think it's paramount that safety is put at first. That when you're thinking about vaccines, ensuring that you're making informed decision, your safety, and also reading, as I've said before, reading relevant information that can inform you and support you to make those choices.
Thanks, Memuna. Did anyone else want to add anything to that? Helene?
I'm sorry, Alex, I'm having a little bit of difficulty. I think my Wi-Fi dipped out.
Actually, Helene, maybe if you can just mute for a minute, I think. Oh no, you're all right now. OK, let's move on to the next question then. Is there any evidence of COVID antibodies being passed on to the fetus for mothers who have the vaccine? Garima, did you want to answer that one?
Yes, of course. If you're breastfeeding, that is the mechanism that how the babies do get protected from any of the illnesses. So again, going by historic evidence, and I'm sorry, I'm not sure of any studies that has been done on the breast milk and what is the titers, etc. About the COVID antibodies as yet, but I'll certainly look. But it shouldn't be any different from what we have done on the same model for the previous diseases. So yes, there would be antibodies in the breast milk for the baby to be benefited from.
Thanks, Garima. I think that was really helpful. I think the question actually was a bit more about whether it would be passed to the fetus during pregnancy if the mother was vaccinated.
Oh, right. Sorry, it was about the through the placental circulation. Is that what the question is?
Well, so the question is yes. So the question is there any evidence of COVID antibodies being passed to the fetus for mothers who have the vaccine?
I do not think so, because there is a placental barrier that does not allow many things to be passed through the fetal circulation. So the first exposure to the baby is through the breastfeeding, as far as my understanding goes. But Helen, you can add if you have any further information about that.
No, and it's the first time I've been asked that question and I don't know the answer. So I think that is one I'll need to take away as well.
Yeah.
Thank you. Yeah, we'll follow that up and get back to people. So this is one I've not heard before. Does the vaccine affect contraceptive pills?
No.
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 That was a nice clear no from everybody. Sorry, I'm just scrolling again. There's so many questions here. I've had AZ while pregnant and I'm due a second dose a couple of weeks before I'm due. Hearing that Pfizer and Moderna are recommended is a bit of a worry to me. What would you recommend? Helene, do you want to?
Yeah. The advice is if you've had AstraZeneca already, then you should continue and complete the course with the AstraZeneca. There is no evidence of there being any problem with AstraZeneca in pregnancy, as far, you know, sort of, there's not been any signs or any information given to us about that. The only reason why the JCVI made the decision to express a preference, and they were very careful to use the word preference, not mandated, a preference for the others, was just because of the high numbers of pregnant women who'd been vaccinated with the other vaccines in the US. But if you've started with AZ, then the advice is to continue and finish with the AZ, the AstraZeneca.
Thanks, Helene. This is the thing about, this is a question about immunity. If I've already had COVID and one dose of the vaccine and then fallen pregnant, is there any possibility that the immunity is sufficient for me to avoid the second dose until after the pregnancy?
Again, the advice is to continue and complete the course with the vaccine and go ahead and have the second vaccine. The reason for that is there's no guarantee of how long the effect of having had the virus is still going to be anyway protective for you. And so the advice from JCVI is that you still go on and complete the course of the vaccination.
Thanks, Helene. So this is a more general question about the vaccines. How does the vaccine protect others? As I understand that we can still contract COVID even if we've been vaccinated. Sorry, and therefore, yeah, even though, yeah, sorry, I think that's the question.
So just so I'm clear, Alice, the question is how does it protect other people? So
yeah, so I think there's the person's, so let me just read the whole question. How does having the vaccine protect others? As I understand that I can still get COVID and therefore be infectious, even though our immune system will be set up to protect us and give us less critical illness.
Yeah. And again, this is part of the difficulty where this is all still new. And so at the moment, we've not been given enough evidence and don't have enough information to absolutely guarantee that you don't transmit the virus after vaccination. What we know about other vaccination programs is, of course, is that it does reduce transmission. It doesn't stop transmission completely in all of those cases. So I think that's the other thing to say, is nothing is ever 100%, but it does reduce it. And so, but we are assuming, and there is ongoing research about this, but the assumption is that when we have people vaccinated, that the ability to transmit the infection to other people will be reduced.
Thanks, Helene. Garima, I think this one might be for you. So I've had both doses of Pfizer and the last one was in mid-March. I also suffer with a blood clotting disorder called factor V Leiden, which requires a dose of Fragmin daily when pregnant. When is it safe for me to start trying for a baby?
As I said, you don't have to wait for anything. Whenever you want to start, you can start. There's no risk to you or your attempts to trying to have a baby. So whenever you want, that's absolutely fine.
Thanks, Garima. A lot of women have experienced menstrual cycle irregularities since having Pfizer, and that includes late, missed or very heavy long periods. Why do you think this is, and what are the possible causes and links for this? Is this a cause for concern? It's not currently listed as a side effect, but I've definitely heard a lot of people experiencing it. Helene?
That's a really interesting question, and again, that's not one that I've asked before. So thank you for raising it, because I will go and check some of the social media sites and things as well to see. It might be it's a new thing that's circulating. You're absolutely right. There's no evidence for what you've described that I've seen about it. But what I will do is I work with the team who are looking at the vaccines. So I will go and specifically ask the question to see if they're hearing that from other sources as well. To my knowledge, and again, I will come to Garima in a moment, but my experience is that I don't understand what the mechanism would be to interfere with ovulation or period cycles or the duration of periods. I don't understand how that could possibly be biologically. But I will come to Garima now. But thank you for asking the question, and I will check if people are hearing it elsewhere Garima, do you have any thoughts on that?
Like you, likewise. The only thing I will add that the periods during the course of my career I have seen are affected by a variety of things, stress being one of them. So, you know, when you have your exams or things coming up, sometimes you see that your periods are either shorter or longer. It seems very coincidental that when people are having vaccines, there could be a period delay, etc. But there are lots of things happening in the country which we all are experiencing at the moment. But like Helene, I'll go and have a look, but I haven't sort of any mechanism to explain anybody that why that should happen.
Thanks, Garima. I'm going to read this one out directly. It's quite a long one. I wanted to ask about having the vaccine while planning to get pregnant. Please bear in mind that my age is 44. I'm 45 later this year, and I also have type 1 diabetes, which is very well controlled. I'm very unsure whether to have the vaccine due to possible side effects for the baby. With my age in mind, I don't have the time to hold off. And because I'm type 1 diabetes, apart from being type 1 diabetes, I'm fit and healthy with normal BMI. I'm really worried about birth defects, so I'd rather risk catching COVID than risk having a baby with birth defects. Thank you. Memuna, did you want to try that one? Or
Yeah, I'm happy to start, and Helen, you can support as we go along. I think it's worth to mention that pregnant women, along with breastfeeding women, are routinely offered vaccine in pregnancy. So they receive flu vaccination and whooping cough vaccination. These are non-live vaccines, just like the Covid-19 vaccine. So if that just puts a little bit of safety into it, to say, whilst you're pregnant, we offer you other vaccines. So with the COVID vaccination, it's just, again, ensuring that we're educating women, saying that it's safe, you can have it in pregnancy. Talking about with diabetes, that puts you at risk whilst pregnant. So again, another reason why I would recommend you should have the vaccination whilst pregnant. And side effects, as you mentioned, would be sore arm, which I think balances out. I'd rather have a sore arm and not be sick from COVID. Headaches, feeling achy. So those are the side effects I'd think about. However, I'd definitely recommend have your vaccine with those risk factors.
Thanks, Memuna. Helene, did you want to add anything to that?
And I don't take that lightly. You know, I think that sits with me. I remember feeling a lot of those anxieties as well, just with slightly different conditions. But so thank you for sharing that and for asking the question. My thoughts would be that to contract COVID, which, given that we're entering into a period of time at the moment where we're starting to release the lockdown, and there will therefore be more virus circulating, to contract COVID when pregnant, as you've described in your set of circumstances, would be far worse than the impact and side effects of the vaccine. And in terms of impact of the vaccine on the fetus, there's absolutely no evidence, and again, I cannot understand a sort of biological reason why there would be an impact on the fetus in pregnancy, which is again why, as Memuna really helpfully articulated, you know, we do give other vaccines that are just like these in pregnancy to protect mum and baby when born. I hope that's helpful, and I really do wish you all the very best.
Thanks, Helene. Yes, and thank you for the question. So the next question is, I'm a wheelchair user, so I'm more prone to blood clots. I'm also worried about fertility in the future. Is there a particular vaccine that you would recommend I have? Garima?
Right. So I guess your question is whether to go for AZ, Pfizer, or Moderna. So the kind of grid that had come about who uses which vaccine outside pregnancy is looking at the benefit versus harm of the AZ vaccine. And what they have recommended it that the benefit in all age groups is more with the AZ vaccine, except people who are less than 30 years old. Now, the AZ vaccine, when you're talking about the clots and worried about the clots, it's just an idiosyncratic reaction. So it is not something due to your situation of using the wheelchair, etc., and being more prone to clots, etc. It is just one of the bizarre reactions that happens to some people. So I wouldn't be worried about that at all. Regarding fertility, I've got absolutely no concerns anybody using the vaccine or having to wait for their treatment. But it is a very valid point that you have raised. Helen, do you want to come in here and say something?
Yeah, the advice about the AZ vaccine is that in people who are under 30, we're expressing a preference for Pfizer or Moderna and a sort of away from the AstraZeneca. For anybody who's 30 or over, that advice is not the same because the risk benefits don't change, and actually it's much more beneficial for you to get the AZ vaccine. For the under 30s, the things to be aware of is that for anybody, the risk with the AZ vaccine of clots is still extremely rare. It is very rare indeed. Nonetheless, those people who do have a problem, it is a serious problem, and there's lots of investigation and study going on and to try and understand the biological mechanisms behind it and whether the association related to the vaccine, which is about the platform, so the way that the vaccine delivers the antigen into the body. They're looking as to whether there's some sort of interaction for very few people with that, but there's ongoing work about it. But if you're under 30, the advice is to get the Pfizer or Moderna. But if you're over 30, any of those is absolutely fine. Does that help?
Thanks, Helene. I think this one might be for you. I haven't heard this, but the question is, side effects of Pfizer are now showing to be shingles, which is dangerous to pregnant women. Is this still the recommended vaccine? I'm not sure if that's something you've heard.
No, it isn't something I've heard at all, and there's nothing with the Pfizer vaccine that has anything to do with shingles or the varicella viruses at all. So I'm not sure where you may have read that or seen that, but that's not in any of the evidence or information that I've seen.
Thanks, Helene. I think so. This is a follow-up question to one of the previous ones, and I don't know if we can expand any further. So the question is, I don't feel that my question was answered, and this would be the main reason for me taking the vaccine. Can you tell me more about the outcomes that you mentioned for those who don't vaccinate but then get COVID in pregnancy? Perhaps you can, yeah, I think they're asking for a bit more information on that.
My understanding is that the main risk for people who have COVID in pregnancy, particularly in the last trimester, so the last 3 months, is that you're more likely to have an early delivery, so your baby would be born prematurely. That's my understanding, but Garima, I don't know if you've got more.
Absolutely. So for the babies, this is more about the preterm delivery. For the mums, if you have got COVID in the later pregnancy, you're much more prone to the severe disease and wanting more of a respiratory support if you have it in the later pregnancy. So these are the main two things that have come up. But as I don't know if you are aware or not, but there is an extremely good surveillance system in the obstetrics, which is ongoing, which Memuna knows. That is a UK obstetric surveillance system, the yellow card system, etc., which is taking all the information about all the pregnant women. And I'm sure as we go forward, we will know a bit more about the outcomes. But right now, these are the two outcomes they have looked at, that what is the effect on the pregnant woman, the disease being more severe, using more of the oxygen and the ventilatory support, and for the babies coming prematurely.
Thanks, Garima. We are slightly running out of time, but there's a couple of questions I can see that I don't think we've answered. So the first one is there any link between vaccination and miscarriage? Memuna? Are you happy to answer that?
Currently, there's no evidence that does suggest there's any association with miscarriages and vaccination. So from my point of view, currently, no.
Can I just add something here?
Yeah.
What we do not, I think me included, sometimes we do not understand or come to the fact that in the background population, there is a background rate of miscarriage, whether we have vaccine or not. So 15% of the pregnancies anyways, whether they are the IVF pregnancies or natural pregnancy, unfortunately, will result in miscarriage. Somebody had written about the congenital abnormalities as well. So in the background population as well, 2% of the people will have babies that will have some sort of a congenital abnormality. And that is not to be, the vaccine can hardly be blamed for that. So I just wanted to make it clear to everybody.
Thanks, Garima. That's really helpful. So this is a question about asthma. I'm asthmatic and I'm planning on having children in the near future. I'm in my mid-30s and I'm very unsure about taking any of the vaccines at all. Can you advise on what I should do, or should I just wait until after I've had a baby? Helene?
Thanks. So I've actually had a conversation like this with one of my patients just this week, almost identical in the discussion. And my advice as a GP to her is the same as I give to you, is to get your vaccination as soon as you're offered it, and it doesn't, when you're not pregnant, it doesn't matter which one you have, as long as you've not got any of the sort of absolute contraindications for any of the vaccines. But there's no preference when you're not pregnant unless you're under 30, as we've already said. So if you're mid-30s, like you've just, I think you just said mid-30s, then absolutely all of the vaccines are available to you, and that I would advise you get it sooner rather than later.
Thanks, Helene. And I think this might be the last question that we're able to ask today. So you've mentioned that cases will be rising in the near future. I do have concerns with the changing guidance for healthcare workers after 28 weeks working in a clinical setting. I have not been vaccinated, as I was advised not to get it when I was 12, as I have no health issues. Please, can you give me advice on working in clinical settings after 28 weeks? Helene?
Alex, I'm sorry, you cut out in the middle of that, so I think I probably missed the key parts of the question. Do you mind just repeating it? So sorry.
So I think this is a concern about rising cases in the future and not being vaccinated. So they're concerned that the guidance has changed for healthcare workers after 28 weeks who are working in the clinical setting. They've not been vaccinated as they were advised not to get it when they were 12 weeks pregnant. And do we have some advice on working in a clinical setting after 28 weeks?
Yeah. So I'll come to Garima as well, but the advice has changed. You're absolutely right, it did change. So initially, when we didn't have all of the information that had come through from the States, the advice was to wait, whereas now the advice is to have your vaccination in line with the cohorts of the JCVI. So if you're a healthcare professional in a clinical setting, you are in one of those cohorts, and so the advice would be to have your vaccination.
I'll just add 2 points here, because you're the other thing is your occupational health risk assessment does not change whether you have a vaccine or not. So after 28 weeks, if you have got any concerns about your healthcare environment, your clinical manager and the occupational health should be able to help you regarding that. And I cannot stress less that vaccine or no vaccine, we all have to make sure that we keep social distancing, hand washing, masks, etc. So that is a really important point to remember whilst we are all in the hospitals, that we take these precautions along with the vaccination.
Thanks, Garima.
Thank you.
I think so. Unfortunately, we have run out of time, and I know we haven't got through all the questions, but we're very happy to keep running these sessions as long as there's demand. So please fill out that feedback form on the link that I think Laura's put in the chat for us today. I think Laura's also just going to put the Slido link back up again. It would be great if you can let us know again about your intention to have the vaccination. And as I said before, that's all anonymous, and you know, it's up to you completely if you want to answer that question or not. Thanks again to everybody for joining us today, and thank you to the panel who've been fantastic as always. And I'm really sorry again for the technical issues that we had at the beginning. It has been nice not to hear myself speaking in my ear 3 times. And I look forward to seeing you all again soon. Thanks very much, everyone.
Thanks, everybody.
Bye.